Hello and welcome. If you found your way here, it's probably because you or someone you love is recovering from rectal surgery. We're going to talk about a really common, but often pretty difficult set of challenges that can show up after that kind of operation. The very first step is just understanding what's going on. So let's walk through it together.
So, does this sound at all familiar? You've gone through the surgery, the hard part is supposed to be over, but now you're dealing with a whole new kind of problem. Your bowel function just feels like it's all over the map. It's unpredictable, and it's really starting to get in the way of your day-to-day life.
Well, the first thing I really want you to hear is this. You are absolutely not alone. What you're going through has a name. It's called Low Anterior Resection Syndrome, or what everyone calls it, LARS for short. And just giving it a name, that's a huge first step toward understanding it and, more importantly, managing it.
Okay, so why does this even happen? To really get a handle on LARS, we first need to take a quick look at what's actually happening inside your body after the surgery. The changes are pretty big, and sometimes they can be long-lasting.
And we're not just talking about a short-term recovery thing. Get this, studies show that a really significant number of people, as many as 41% of patients, are still dealing with major LARS symptoms years after their surgery. So for a lot of folks, this becomes a chronic condition they learn to manage.
To put it simply, the surgery kind of changes your internal plumbing. It can affect the really sensitive nerves that control everything down there, it can impact your pelvic floor muscles, and this is a big one. It removes the rectum, which is the body's natural storage tank for stool. It's really the combination of these things that leads to LARS.
So what does all this officially mean? For a long time, there wasn't even a clear definition for this group of symptoms, which made it really hard for doctors to study and treat. But that's changed. Experts and, importantly, patients got together to pin down exactly what it means to live with LARS.
And this is the definition they came up with. Now, it sounds a little clinical. Disordered bowel function after rectal resection leading to a detriment in quality of life. But that last part, leading to a detriment in quality of life, that is the most important part of the whole sentence. It's not just about the physical stuff. It's about how it's affecting your actual life.
And I think how they got this definition is so important. It wasn't just a bunch of doctors in a room. Researchers went straight to the source. They talked to 156 patients who were living with LARS, and they just asked them, what is this really like for you? So the definition itself is built on real-world human experience.
And from those conversations, a clear set of symptoms emerged. Things like urgency, that feeling where you have to sprint to the bathroom right now, or incontinence and soiling. Going to the bathroom really frequently, or the total opposite, feeling like you can never quite empty completely. There's also something called clustering, which is when you have a bunch of bowel movements in a really short amount of time. And then there's just that general, frustrating unpredictability. If you have LARS, you're dealing with at least one of these.
But here's the key. Remember that definition? A symptom only really becomes LARS when it leads to a consequence. This is that detriment to quality of life part we talked about. It's when the symptoms start messing with your social life, your relationships, your job, your peace of mind. It's that constant nagging thought in the back of your head, where's the nearest bathroom? That's the real experience of LARS.
Okay, so if all of this is starting to sound way too familiar, what's the next step? Well, it's starting a conversation with your doctor. Getting an official diagnosis is the real first step to getting help and building a plan to manage it.
So, when should you have this chat? A really good time is about 3 months after your surgery, or 3 months after an ileostomy reversal if you had one of those. By that point, your body has had a chance to do some initial healing, and the new patterns of your bowel function are starting to become a little clearer.
Your doctor is going to take a really careful approach. First, and this is so important, they're just going to listen to you. Then they'll want to make sure nothing else could be causing these symptoms. They'll probably ask you to keep a bowel diary for a bit, which is an amazing tool for spotting patterns. And then they'll want to talk about how all of this is really, truly impacting your life.
And now let's get to the hopeful part, the treatment. I want you to think about this not as finding one single cure, but more like building your own personal toolkit. There are a lot of different tools out there, and the goal is to find the right combination that actually works for you.
Now, this is a really crucial idea to understand about the treatment. The whole approach is additive, not replacement. What that means is we don't just try one thing, and if it doesn't work, we toss it and try something else. No, we start with a solid foundation, and then we thoughtfully add new tools on top of it, building a whole strategy that works together.
And this is basically what that strategy looks like. You can think of it as a treatment ladder. You start on the first rung, the foundation. Simple, but really powerful changes to your diet, fiber, and how much water you drink. From there, you might climb to the next rung and add medications to help regulate things. Then come other therapies, procedures like colonic irrigation, and way up at the top, more advanced options if they're needed. It's a clear, step-by-step process.
Let's just talk about one of those procedures for a second. Retrograde colonic irrigation, or RCI. It's so important to know this is not a simple enema you buy at the drugstore. It's a very specific technique that uses a larger amount of water to gently wash out the colon. And the whole point is to empty the bowel on a predictable schedule. This can give you a long stretch of time, hours, even a full day, where you're secure and symptom-free, which lets you take back control of your day.
So, where does all this lead? Well, it leads to a new way of thinking about your body and your health. This final section is all about managing this for the long term, and most importantly, it's about hope.
I think this quote from a major medical textbook says it all. It says that LARS should be viewed as a chronic disease, kind of like diabetes or high blood pressure. It needs ongoing management, little adjustments over time, and a real partnership with your healthcare team to keep your quality of life high. That idea, that reframes everything, doesn't it? It's not a failure, it's a condition to be managed.
And that brings us to maybe the most important takeaway of all. The goal here might not be a perfect cure that makes everything exactly like it was before. The goal is meaningful improvement in your quality of life. It's about loosening the grip that LARS has on you so you can get back to doing the things you love. And all the research shows that with a step-by-step approach, that is absolutely possible.
So what can you do right now? First, talk openly with your care team. Don't hold back. Start that bowel diary. It's your data, your story. Be patient with yourself and with the process. Finding that magic combination of tools can take some time. And above all else, please remember that real, meaningful improvement is possible.
We've gone over a lot today, from what LARS actually is to all the ways it can be managed. Everyone's journey with this is personal, but it's a path you do not have to walk alone. So, I'll leave you with a question to think about. What is the very first step, no matter how big or small, that you can take on your path to managing LARS? Thank you so much for your time.